You should hear. Mic check 1, 2, 3, 4. Mic check. Mic check 1, 2. Mic check.
Do you hear that on your computer?
Mic check 1, 2, 3, 4. Mic check.
No.
Shit, anything? Mic check 1, 2, 3, 4. Mic check.
Yeah, that was it. It was
The music. It's the
Okay.
music.
What?
It's the music.
Oh, and also the music. Okay, and there's a mute, but you can hear. You heard
Mic
the stuff
check
on the
1,
thing?
2, 3, 4.
Okay. Yeah. Perfect.
Yeah, okay, all right, that's a great answer. You need to get out of your life. You're not in control. Better get We'll see.
When you get a chance, that's all.
Thank you so much Hello, everyone, including everyone outside. We're going to start in about 5 minutes.
You just turn it on like that. But let's turn it off right now.
Okay.
You know, it's easy for people to say, "Oh, I'll be," but, you know,
Yeah.
Everybody like here.
Kelly,
You'll just say what.
Dependent Mugira,
And then as you say their name, they're gonna come up, sit down, and then right after you finish.
and then I'll introduce Jim, and he'll come up,
They'll come up and take it.
and then I'll just take it over Jim. Huh? There are still seats over on this end if you need a chair. Okay, we will begin in just about 1 minute. So please find your seats. There are chairs over this way, in case any of you want them.
looks more full.
All right, standing room only. How wonderful. Welcome. Welcome to World NTD Day at the Task Force for Global Health. I'm Dave Ross. Yes. Actually, I think Kelly is applauding World NTD Day, not Dave Ross. So I'm Dave Ross, the President and CEO of the Task Force. I'd like to welcome all of you. Just a quick show of hands. How many of you, is this the first time at the Task Force? Whoa. Wow. Well, welcome. Welcome. I would encourage those of you who are new here to spend some time in the lobby, out at the displays, look around, look at what's being scrolled on the screens in the lobby, learn about us. We also have a very nice patio out here if you haven't already discovered that. And welcome to our relatively new, beautiful facility. In introducing this panel, I thought I would just make a few remarks about NTD, since we're here for World NTD Day. And, you know, so I'm going to assume that you're not all experts, although we do have people in this audience who are world authorities on these diseases. So I'm not one of those, but there are people here in the audience, and I would encourage you to find them. if you want to know more. But it stands for neglected tropical diseases. And these diseases represent 20 diseases that are found largely in tropical and subtropical tropical regions of the world. These are diseases that often snare people into a state of poverty because of the illness, disability, and pain that they inflict. But because these diseases have largely existed in areas that are off of the beaten path, they are diseases that have inflicted blindness and disfigurement and terrible pain, and little attention was given to them, and hence neglected term. But beginning in the 1970s, this is the Dave Ross short course version of some of the history that brings us here today. In the mid-70s, Robert McNamara, who was president of the World Bank at the time, discovered the situation of people living in areas that where this fly-borne infection was causing them to become blind, suffer terrible itching, and in effect forced them out of very arable areas and out to desert areas to be away from the flies. So it was a trade-off between being able to farm and make yourself more prosperous, or suffer in the desert to avoid this infection. But if you stayed near the rivers, you could potentially end up blind. It was a terrible situation, and he actually began the first program for the World Bank in health as a vector control program to help rid these areas of the spreading infection we call river blindness. A few years later, in the early 80s, a scientist at Merck discovered that an active ingredient in one of their veterinary medicines could cure or kill the parasite that caused river blindness. And that began the journey that brings us here today. That discovery eventually led the CEO of Merck to come to Dr. Bill Foege, who was the head of the task force, the creator of the task force at the time, and ask if he would help Merck and starting a river blindness program to bring drugs to those who needed it. So it was envisioned as a control program. Bill Foege, to his infinite wisdom and the world's gratitude, said, yeah, I'll do it. And formed a partnership with Merck that we call the Mectizan donation program today. Around the same time, these unique characters that inhabit Atlanta, Bill Foege and President Carter started the Carter Center and took on another terrible infection, guinea worm, as the first, I think it was the first disease for the health part of the Carter Center to eradicate guinea worm. And we're sort of almost there. Would that be a fair way to characterize it? Our panelists can talk about this. So that was the beginning of all of this. And then came a march towards elimination of other diseases, other NTDs. So here it was about 8 years ago, and a meeting in London that led to the London Declaration. And that was a call for action to eliminate 10 of the NTDs. So the programs here at the task force and with our partners at the Carter Center and many other partners, we work on, I think, 5 of those diseases, and a lot of progress is being made. I'm incredibly proud to be able to be a part of an organization that does this kind of work. We have colleagues here in the room who work in these programs. You will hear from some of them this afternoon on the panel, but these are programs that are bringing better health to literally hundreds of millions of people around the world. I mean, the scale of this work is often, to me, just staggering. when you tell someone that I work for an organization that with its partners are treating hundreds of millions of people every year, not many people can say that. This is a joy to be able to be a part of such a wonderful organization. So this panel this afternoon is going to talk a bit about these NTDs, the work we do, and the progress being made, and I don't know what all else, but we have a wonderful panel. Kelly Callahan, who is director of the Carter Center's Trachoma Control Program. Dr. Upenda Mingwira, I knew I told you I would have trouble with you, is the senior NTD technical advisor at RTI for USAID's ACT and NTDs East program. And Najwa Sampson, who is the logistics coordinator here at the task force for our International Trachoma Initiative. So these three women will be joined with a wonderful moderator. We have the good fortune, must say thank you, to Mr. Jim Burris. So as a sustaining member of, yes, give a call out for public broadcasting. Mr. Jim Burris is host of All Things Considered. He will serve as our panel guide this afternoon. And with that, I'd like to introduce Jim and our panelists. Please come up.
Yes, thank you. All right, well, thank you, Dave. Thank you to our panelists. Thank you to the audience for coming this afternoon to talk about such an important topic. And we have folks on the web watching as well, so we want to welcome them. I want to start with a little story, an anecdote. First, it is a pleasure to lend my voice to such an important topic. And when I say lend my voice, I mean that from the heart, because 1 year ago this week, I had a surgical procedure that paralyzed my right vocal cord. So for the first 6 months of this year, I did not know if I would ever speak again.
Wow.
This is very troubling to someone who makes his living speaking. And I say that only because I can empathize with what it must be like to be in a situation where suddenly a medical condition takes something from you and leaves you unsure about your own future. I cannot sympathize, though, because unlike the conditions we're talking about today, I had access to medical care, experts, transportation, very privileged things that are not the case in what we're going to talk about today. And I think that's important to keep in mind, that we're talking about not necessarily the diseases or the organisms, but we're talking about the situation and the socioeconomic condition and the political organizations that are key to keeping this an issue. And so when you think holistically about that, I think it's a good context for the conversation. So we'll start with that. And I always like to know what motivates people. So the first question is, and we can go down the line, why do you do this? Kelly, would you start?
That's a tough question for me. Can you hear that? Yeah. I was asked in 2004 when I first returned to Atlanta from living overseas for many years, why I do what I do. And I made a presentation, I called it Love. And my first slide just said love, and it was just pictures and quotes. Because for me, it's really all about love. It's about there before the grace of God go I, and put myself in the shoes that you just described you were in. And recently, this past year, we just started surgical services for trachoma, again in South Sudan. And a young boy, a 10-year-old boy, was carried 120 kilometers on the back of his father to a surgical camp where the surgeons no longer were, and had to go to the second camp where the surgeons no longer were, and then went to the third camp to receive sight-saving surgery. Very simple 20-minute procedure. So this young boy wouldn't go blind. And that, to me, is love. That is the true essence, giving everything I have, everything that I can possibly come up with to someone else to make their life better. So for me, it's love. That's why I do what I do.
Thank you. Upendo?
Yeah, thank you. For me, let me start with a story. I was trained as a medical doctor, and I was trained outside Tanzania. So I went back home doing my internship before starting the real practice. So during that time, I noted that there are a lot of diseases which could be preventable. People would be prevented before coming to the hospital. So as soon as I finished my internship, I was just looking for something which will make me serve many people, serve the needy people, and prevent them from getting to the hospital. So I joined the Research and Public Health Institute, where I started working on this lymphatic filariasis. So I think it's a mix of my training background, my medical career. I feel satisfied to help the needy people, but also helping many people at once rather than one-to-one.
Thank you. Najwa?
For me, I will agree with Kelly. It's just the love for helping people. I'm originally from West Africa, and my family moved to Atlanta about 30 plus years ago in search of a better health care for my brother who had sickle cell anemia. And Atlanta at that time was known to treat the disease. It was one of the best place to treat the disease. And I often think about when I do this work, how fortunate I was to be able to have that opportunity to be here. And my mind goes back to the people that I work with, that they might not never have that opportunity to be here, to be able to experience what Jim spoke about, having that privilege of insurance and having healthcare available to you.
Thank you. I understand on first, happy NTD Day. Well, that's the proper way to say it is a happy day.
Yes.
And that in 2020, there are 20 recognized designated NTDs. Can you give us an overview of anybody who wants to jump in? What are the ones that are the biggest challenge globally? What are we talking about?
Ooh, I'll start. I'd say guinea worm disease, first of all. It's an eradication program, and there's only 2 diseases slated for eradication globally right now, polio and guinea worm. And, to quote Bill Fegge and Dr. Mwele, who works with WHO, this battle is long and hard and comes with twists and turns. And guinea worm has had many twists and turns. This is a battle that started back in 1986. And it is a horrendous battle, not only because it's a 3-foot-long worm coming out of someone's body, and that's awful, but it doesn't kill immediately. So keeping everyone's profile, keeping everyone focused on it, that's really tough. That's a hard one, I think, in terms of keeping it going to the very end. Eradication is strictest eradication. It's not controlling it. It's not just eliminating it country by country. It's globally gone. And that's challenging, again, with the twists and turns that have come up.
And there are 53 cases, as I understand, now left?
In 2019, there were 53 cases that were reported globally from 3.6 million that were estimated at the beginning. So a 99.9% reduction, but that last little tiny bit is the longest bit, and it's going to take more effort and more intensity behind it. So keeping governments like Tanzania, keeping governments involved and national ministries of health focused on it when there's more pressing issues like lymphatic filariasis or trachoma or river blindness that you brought up earlier. There's a lot more pressing issues, malaria. There are other things that come up. So keeping focused, keeping committed, that's hard to do in the face of an eradication program.
Kelly, I'm sorry, Upendo, how do you do that? How do you kind of make the call that this is important in light of all the other things that are going on?
I think what I've noted, which made it important in my previous career, previous job, is to have stakeholders' involvement and partnership, strong partnership. Yes, the government are in the driving seat, but having partners working together, having clear guidelines from WHO and other partners have really made a great progress. And over the past 20 years, I think there's a lot of improvement in that. And countries have stood up and worked with partners to make sure that they deliver and fill in the gaps on what they are doing.
And Najwa, you mentioned you're from West Africa, from Liberia.
Yes.
And so you have firsthand kind of experience for some of the challenges on the ground for getting, be it a medication or an intervention to people. Talk about that, because many of us have no idea what those barriers are.
I would say a lot of times when you're planning things from here and just trying to understand some of the challenges on the ground, and if you're not present to know exactly what's going on, it's difficult for you to make decisions. My recent trip to Zambia, just participating in the supply chain assessment, we had to travel through like gravel roads and sand to be able to get the drug to the district. And I realized like we don't normally think about like rainy season. We don't normally think about infrastructure. We don't think about those things when we're planning here for the country. In Liberia, on that note, I remember where I stayed and just on a paved road, just trying to get out of the community that I was in. And raining season, I remember my mom and my sister, having to go up that road and having the difficulty as far as getting out of that community. So it's quite challenging to move these drugs in different places. Sometimes it's done by boat, sometimes it's done by bikes, motorcycles. So it takes a lot for that to happen.
So to say a lot, I'm thinking about the logistics of it. You're not implementing UPS. There's not a brown delivery truck that's going through the neighborhood every day and dropping this off.
Not at all.
What does it take to be successful in intervention?
I would say just understanding the challenges that's happening in the country, and like just being hands-on and visit the country to know and talk to local people just to understand some of the challenges that are happening. Oftentimes we just tend to make assumptions from this when we're organizing things from this end, and that doesn't work all the time when we assume something is what it is and is not.
I think, Apendo, you grabbed onto something earlier. It's partnership.
Yeah.
It's up, down,
Yes.
it's all around, it's public, private, it's
Yes.
the Ministry of Health, it's the health
Yes.
extension workers. It's listening to cultural norms.
Yes.
It's listening to the faith-based institutions of the country context. We talk about these neglected tropical diseases and we talk about global programs, but it really does come back down to a very specific country context.
Yes.
Who are the partners in that country? How are they working together? How are they
Yes.
communicating with the Ministry of Health? And then what kind of logistics do they actually have? What kind of human resource structure do they have?
Yes.
And I think that the public-private partnerships that have been formed over the course of this NTD long haul have been phenomenal. And without
Yes.
partnership, Zithromax donated by Pfizer, ivermectin donated by Merck, these drugs to meet these NTD needs of the communities would not get where they needed to go.
Yes.
We were talking earlier about the cost of these drugs, and to think of how small per medication or per dose or per intervention it is, but how much of a barrier there is to get it to the person in need.
Yes.
First, talk about the cost. What are we talking about here? Like, how much?
So far, the estimate is less than $50 cents per treatment. It depends how much is the package. There are areas where you have two diseases, the area where you have one disease. But I think we should also not forget that despite this mass drug administration strategy, there's also other interventions ongoing, like surgeries for trachomas, hydrocell surgeries, scrotum surgeries, so health education, all these together. But the one I'm talking mostly here is the mass drug administration, which is one treatment less than 50 cents of a dollar.
Biggest bang in public health, if you ask me. I mean, really, for your dollar, 50 cents per treatment, that,
It's life-changing.
right?
Yes, great change.
And there's another economic benefit. I don't want to get too much into the money side of it, but that's a small investment for a big payoff.
Yes.
Talk about the numbers that the benefit from that 50 cents.
I'd say economically, guinea worm was called the disease of the empty granary. And that meant that people couldn't harvest their crops because they were debilitated with this worm coming out. And that affects an individual, and then it affects a family, and then it affects a village, and then it affects a community. And then ultimately it rolls up into affecting gross domestic product, gross national product. Then a country has to get a loan from the World Bank. And these things, and think about it, if one neglected tropical disease and someone's infected by, let's say, 2 or 3 or 4, the immune system's response decreases and they're much more susceptible to a killer like malaria. So then you have populations that are affected and dying on top of just the NTDs, and that affects the economy at scale. And these NTDs keep people locked in cycles of poverty and continues to let the gap between the rich and the poor grow. And it's a roll-up effect. You can see the dollars just rolling and rolling and rolling up.
Speaking of dollars, there's a lot of dollars, U.S. aid going to try to eradicate NTDs, but it's a global fight. And I want to make sure that we talk about that too. I understand there's been some development in domestic funding and having countries on board. Who wants to talk about that and kind of give us an overview of that?
I'll give a quick overview. I'm not going to take over and I'll be quiet in just a moment. But from experience in what we were able to do, having a sort of a spokesperson, President Carter was a strong spokesperson for the NTDs and really got some government ownership. And we have several countries now that, like Sudan, that have given their own funds to fund their trachoma and river blindness programs. And if you think about that in terms of the economy of scale, yes, the US government has given a tremendous amount of money, but how much money the US government has and how much they can give away versus how much the government of Sudan has and how much they can self-fund a program. That is a really big, huge, significant effort for a government like that. And Uganda, that has also funded their own river blindness program, and other countries that put in human resources, not just money, but human resources. It's a significant investment.
Yeah, I want to add on that. Yes, as I said before, the most success of this program is towards the partnership. And when we talk about partnership, it's about the national governments, the donor community, the research institutions, the public health institutions, the academia, all of them. So it's an effort of many stakeholders together. So I want to say that national governments have done a lot of work, and actually in most of this area, the implementation also is done at the community level. So there is a cascaded implementation, and the governments are taking care of that. So it's about partnership of everyone around to make sure that this is done. So I'm very happy to come from the area where this is worked out through the support from various partners, including the US government. And we've seen a lot of success towards this endeavor. Yeah.
One of the reasons I'm super excited about World NTD Day, and if you've seen me today, I've hugged you and kind of screamed, Happy World NTD Day, is I think this provides a groundswell, a platform. And I reflect back to 2014 when the Minister of Health of Ethiopia realized what an intense problem blindness from trachoma was in his country and gave a huge amount of money, the equivalent of about $5 million, towards clearing all of the patients that needed surgical services. So the more we talk about the NTDs, the more we talk about what 50 cents can do, or $60 for a trachoma surgery. The more we talk about that, the more engaged we get. I think the more engaged countries get, and ministries of health get, and other governments get.
And I also wanted to shine the light on pharmaceutical companies. I mean, they're donating billions of dollars of drugs to support these programs, and we shouldn't leave them out of the light, because that's a huge amount. And like I said, without pharmaceutical companies like Pfizer, who's donating for the trachoma program, some of these programs wouldn't exist. So imagine they could be utilizing these drugs on the commercial side, but they're actually giving it to people who are in need.
Absolutely. And it's also important to mention that we're not only talking about conditions that are treated by drugs, but there are some that it's a cultural intervention.
Yes.
Talk about that aspect of attacking NTDs. Anybody who wants to chime in?
We talked earlier, we were talking about song and dance and the need for, a panoply of activities to provide health education, to talk about and using pictures, pictorials, and many different aspects. At the clinics in different countries, you'll see posters with just some pictures on them, like the one out front for river blindness, so that people can learn, and culturally looking at different ways that people can share information across many different, perhaps disparate groups. Yeah.
I want to ask kind of a broader question of each of you, and that is, what do you wish that somebody knew about NTDs that you find they often don't? Najwa, would you like to begin?
I would say that they're preventable, and there's medicine out there to treat these diseases, or there's other components that's there, like facial cleanliness and environmental cleanliness, to be able to help prevent some of these diseases. So that the fact that they're preventable and there's medicine out there that can actually treat some of these diseases, I believe most people need to be aware that that's happening.
Yeah, I want to also say that despite that it's a complex program, but like in mass drug administration, but it's feasible, and there's demonstrated evidence that it has worked in many countries, and there is a future hope that comes 2030, there will be some of these diseases will be a history. Yeah.
And you mentioned 2030. That's not just a random date. There's a tie to that. Tell us what that is.
Now there is a development of the NTD roadmap by WHO, and it starts from 2020 to 2030, and it is linked with the Sustainable Development Goals, which are also are also ending by 2030. So it's another date which we are putting, these NTD communities putting towards several milestones we're going to develop. So that roadmap will be launched this year, maybe around May, June. So we will see what is in there. But so far, that's another target date, 2030.
Yes.
And Kelly, what do you wish people knew that you find they don't about NTDs?
I wish people knew that Prince Andrew had schistosomiasis and was treated for it.
And what is that?
Schistosomiasis
Bilharzia.
Yeah,
Bilharzia.
bilharzia. It's a parasitic infection, and probably got it from drinking water, which is what I really wish people knew, is that these diseases are symptoms.
Yes.
The cause is poverty.
Yes.
It's a lack of sanitation. It's a lack of this bottle of water that we take for granted. It is a lack of access to health care. And these diseases make this gap between the rich and the poor grow ever wider. And it keeps these diseases keep people locked in a cycle of poverty. And lastly, I'll say any single one of us could get any one of these if the tides were turned.
Yes.
And that's what I want people to know, that, you know, we're all a lot alike. And we're just separated by maybe a country or a continent, but
Yes.
we're all the same. And
Connected.
we shouldn't have such gaps in equity. We really shouldn't. It's 2020. People should have access to clean water, and that's what I want people to know.
Yes.
Our privilege frames our outlook. How do you get past that to get people to see beyond that privilege and that framework and be willing to take the step to make a donation or to get involved, to be active? When the concept is so outside of our norm, how do you get somebody over that line? Najwa?
I would say it's a collaboration in the sense of, you know, sometimes you think you're here and things won't happen to you. As a child, growing up in Liberia, I read a story. I'm not sure if any one of you have heard the story. It's called the Mousetrap, and it pretty much talked about a farmer who had a mouse problem in his house, and the mouse discovered that the farmer had bought a mousetrap because he had the problem and to catch him. And the mouse went to the farm animals and just, you know, saying out, oh, there's a mousetrap, and just pretty much warning everybody there's a mousetrap. So they weren't concerned because a mousetrap was meant to catch a mouse. And the story goes on to say that the farmer's wife heard a loud noise in the middle of the night, went in to see what the trap had caught, and got bitten by a venomous snake. And what happened, every animal in that farm was affected by that. So the hen was killed for chicken soup. The cow was killed because eventually the farmer's wife passed on and they had to feed everybody. So I say this to say that sometimes these problems are not something that's right here and related to us, but in a way that we should care about other people and just be empathetic as to what goes on in other countries and help people not suffer. So, you know, sometimes we think it's so far away and we're connected somehow, so we need to pay attention to that.
And Upinder, you have specifically seen a lot on the ground in your time and your work. What sticks with you? What is perhaps the most troubling or monumental event that just shakes you? You can't get out of your head.
Yeah, I met a lot of people with these sufferings during my work back home. As I said before, you feel that I have to help these people. And having a solution like mass drug administration was very satisfying. But in one case, I remember we were supposed to conduct a big camp for scrotum surgery, secondary to filariasis. There's a swelling of scrotum as a symptom. So there was this guy who had a very big scrotum. He could sit on it as a chair.
Wow.
And is living in the rural part of Tanzania, southern Tanzania. This guy has been having that swelling for 26 years. Has never, his wife has abandoned him. The child he had one went away with the mother, so he has not seen them for several years. So he was living with his sister and brother-in-law. They are the ones. He was just staying in a very, like a very dirty room in rural Tanzania. So the good thing of mass drug administration, were the distributors for medicines. They go house to house. So they identified him. And when they heard that there is a camp going on, they say there is this person, because usually people have to show themselves. So for this man, he couldn't walk, so he couldn't come himself. So we had to take the program vehicle to go and see, because they came and reported he was in the register. So we had to go and pick him up. You can imagine he could not sit in the front seat. He had to sit in the truck, at the back of the car, because it was so huge. So when we went to when he was brought to the hospital, because it was supposed to be done at the bigger hospital, at the regional hospital, the surgeon said, no, this is too big. We cannot do it now. We have to come back and prepare well. So imagine taking him back to his sister. The sister cried a lot, and I was part of that team. So the sister cried a lot. Why are you bringing him back with the same condition? Can you please stay with him and all that? We had no option. We just had to leave him there. And then, like a month later, we had to go back and treat him. The surgery was done very successfully. He had to stay, of course, in hospital for a long time because the wound was so big. But he came back to normal after a month. Then we went back, and actually I had to solicit the Minister for Health to come and see him. And she came and saw him during her last days at the hospital. He was very happy, went back home together with wearing now the pant, the trouser. He was so happy. So it was very satisfying, and I feel very proud to be part of people who contributed to this person's change of his quality of life. So that's what gives me motivation. And of course, it was first a bad story, but then it ended up very well.
How long ago was that?
Last December. It's almost a year now.
Have you heard what his life is like now?
Very okay.
Yeah.
I have his number, and actually the wife and her child and even they had to come back to see, is it true that he's back to normal? So they had to come all the way from wherever they were. They had to come, and you could see his face. He used to be looking as a very old man, but now he's quite a young, handsome man. You would ever, yeah.
Excellent.
So I want to thank everyone who supported these programs, because yes, the country governments do a lot, but this partnership of multiple sectors and donors, drug companies, and everyone really makes a very big difference. And the way you hear these people, once you do, you provide the service, they say, oh, please tell those people who are helping us, the government and the donors, tell them thank you. So they're really thankful for the generosity of people of America and everyone who is supporting these endeavors from various countries. Yeah.
Kelly, how often do you see a payoff like that? How often do you get a good story that makes you pause in the work?
Well, every day I get to travel, I get them constantly. I remember the first time I met a baby named Mectizan. You feel better after you get a dose.
What is Mectizan?
Mectizan is it's ivermectin, the one that the drug that Dr. Ross noted in his introduction, and it's used towards the treatment of river blindness and the prevention of river blindness. It actually won a Nobel Peace Prize, the 3 scientists that came up with the drug dosage, but it makes you feel better. The parasites, the worms that are in your body are reduced, or they die, and you feel better. So there was a baby named about 9.5 months after Mass Drug Administration named Mectizan, and I couldn't believe it. That was a moment. And I had last year I was in Ethiopia, and I don't speak many of the languages that in areas where I go to, but there was a woman that had trichiasis surgery on both of her eyelids. And she knew us as the Carter Center, the people that were helping with that. And she saw me, and she just came running up to me and crying tears of joy and pointing at her eyes and saying thank you again and again, and kissing my hands and kissing my forehead and kissing my chest. And it was just this constant state of gratitude. I shared no words with her, but I'm a crier, so I immediately started crying, and the two of us just stood there and cried for a little while.
Universal language.
Yeah, of love.
Absolutely.
and gratitude.
I would be remiss if I didn't acknowledge that there are 3 women in front of us. What's it like for you in that respect to do this work? Is it a barrier? Is it a, what's it like?
For me, it's been not easy because I started working in this when I was quite young, fresh from medical school. So thereafter, you need to bring trust to people that you can do it. So sometimes you just say, yes, I can do it, while you know for sure you have not tried it before. But then you have to look for the best support. Who can help me do this? But I think as a woman working with this disease, first of all, most of the time the most vulnerable are women in most of these diseases, like soil transmitted hermins, the worms, women of childbearing age, and children. I also find also in our settings, the caregivers are mostly women. If a husband is sick, it's the woman who takes care of the man. If a child is sick, it's the woman. So it motivates me to work hard and save the life of my fellow woman, to make sure that I'm relieving the burden for her. So it has worked, and I feel proud to be a woman and working in this area.
I would say, since I'm kind of new to the task force and just working with women here at the task force, I haven't had that much of a barrier. I'm sure once I get a chance to visit other countries and do the work, maybe I might experience some. But one story that sticks out to me recently, we did a training in Zimbabwe, and we were very impressed with the supply chain system. And we realized there were so many women in different areas that was running and supporting this program. So we kind of joked to say, this is the reason why it's so efficient. So, so far for me, it's been good. I haven't reached any challenges regarding that, but I'm sure there's some to come. And when that opportunity comes, hopefully I'm able to be able to rise up to those challenges.
I'm sure you will. Absolutely.
Yes.
Kelly, I know that because you've shared with me one example, but what's it been like for you?
It's been hard. It's been really hard.
Mm-hmm.
I started in a small village in the Ivory Coast, a very patriarchal society. Women don't have a big voice. Women don't have a voice in most instances. And then I transitioned to a war zone for 5.5 years. And, wars led by men, essentially. And most of the people I worked with at that time were men. And I had to learn payloads of planes, and I had to learn things that I never thought I was going to learn. And I really had to puff up. I had to get big. I had to take up space. I had to get strong, because the men wouldn't listen to me when I said, well, I don't think we should use a Caravan 110 because the payload is only 2,100 on that. And they're like, you wouldn't know that. Or, I really think we should go into this area in Upper Nile of South Sudan, and them saying, no, honey, it's too insecure for you. You'd be better safe here. And just really coming up against that and hitting that wall again and again and again. And but I'm really fortunate that I have worked with a couple of amazing men that are in this room, and some not, including President Carter, who really believes in the voice of women, and have really promoted women and the teamwork involved and trying to close that equity gap. But it has been hard. It's been tough. Patriarchal societies and the NTDs, the neglected tropical diseases, mostly exist in Africa. Yes. Nigeria and Ethiopia are the two most populous countries, and Ethiopia has more than half the global burden of the neglected tropical diseases. So patriarchal societies are tough, especially if you're a strong woman, if you come out strong and you know what you're talking about. It can be really challenging. And you have an MD and a PhD. It gives you a little edge up. When I started, I didn't even have an MPH. I was just passionate.
But I ended my master's and PhD while working in NTDs. And I also had 2 babies while I was working in NTDs.
That's worthy of applause for sure. We have just a few minutes left, and I want to talk about the presence here in Atlanta. So much is going on in this area to treat NTDs. What's it like to work in Atlanta, and how kind of give us a sense of how big a player this region is globally? And Najwa, I'll start with you because I know you work a lot with logistics.
Okay. So it's what is it to work in Atlanta?
Yeah, kind of give us a scope of Atlanta's place in this overall picture.
I would say Atlanta is moving more towards public health and healthcare in general, and this is the place to be. Like organization like the task force provided me the opportunity to join this movement to be able to do so. I never knew that the task force existed and like was right in my backyard. I work about 20 minutes from here, and I was in search of finding a humanitarian organization where I could do things on the global scale and discovered that the task force was right here. So there's a lot of things that are going on in the task force. There's a lot of stuff that's happening with Emory and just different things. So I would say Atlanta is kind of like the hub for public health. And, I would just like to just encourage more young people to kind of join the movement. And there's so much work to be done here. And we can all collaborate, and you can bring in new ideas, and we can eliminate some of these diseases in the next 20 years. So we need all of you.
I would be remiss if I didn't state that President Carter in 1986 started working with Dr. Bill Faggy and others on Guinea worm disease. And President Carter chose Atlanta for the library and museum of his presidency, not necessarily for the library and the museum, but for what an institution could be built as a legacy, and to start working on guinea worm disease and start working on human rights. And it was through that each of these NTDs started adding up and adding up and adding up. And then you look at this nexus, the Georgia Global Health Alliance is here and working with the Task Force for Global Health. CARE is here, MedShare's here, MAP International is here. I mean, this is a powerhouse of entities working together with Emory University that is an amazing institution. And these institutions all come together to get the Crown Prince Court to advocate for the first World NTD Day. And that all starts, here, goes out there, and then comes back here. I think Atlanta is quite an nexus. I mean, billions of dollars of drugs go through this task force. It is a task force for global health, and it's a hub and spoke. It hub and spokes in Atlanta, and then a greater hub and spoke out across the world. So it's really, to me, it's super exciting and an amazing place that doesn't get a lot of play in the global health world.
Upinder, we're about out of time. I want to give you the last word. What would you tell people who may be watching online or in the audience who are thinking, well, what can I do as an individual? What can we do to help stop NTDs?
First, I think there is a need to understand how these diseases are contracted and how can we prevent. As I said before, it's very easy. We have tools to prevent these diseases. We have capacity to prevent these diseases, and we have all the people around, the researchers, countries are ready, and everyone. So I strongly believe that it's very much, we are near there. And I believe that the vision for me is to come to a time whereby these NDAs will stop everywhere, and very few people will be just going themselves because of their education, because of the knowledge they have on diseases. They'll just go themselves to the health facility whenever they're sick to get medicines.
And we wouldn't be able to call it a neglected topic. Right? Absolutely, that's the goal. Well, happy NTD Day.
Thank you.
Thank you all so much for being such great panelists and giving us the insight that you did. You're not off the hook yet. I asked the easy questions. The audience asked the hard ones. And so we're going to open it up now to some Q&A. If you have a question for the panel, just raise your hand and we'll bring a mic to you. And also, if you're watching online, I understand you can leave a comment in the YouTube channel, and that should be able to get to us as well as a question. We have a few. You're up front.
Hi, as we're all getting older, we want to make sure that the young people are involved. So what is being done to make sure that young people are aware? I work in a middle school, and I'm sure many of my students have never heard of a neglected tropical disease. So what are we doing to make sure that they're aware, because they're going to be the ones on the forefront of making sure we can eradicate this in the tools and resources that are out there?
That is such a great question. And I have probably one of the most remarkable teams, and I'm biased, of course, but just at an elementary school last week, my senior epidemiologist took a group of our team to the middle school for the science evening and had spaghetti and wrapped the spaghetti on sticks to teach people about guinea worms. So there's not enough being done. There isn't. And it's really hard to do more when we're doing our everyday jobs. But things like this and sharing these things, if you can, if there's science fairs, if there's anything that happens at a school. The Carter Center has a wonderful education department. We have internships and graduate assistance programs. We would love to send children or send people out to schools. That would be fantastic. And I know the task force, wink, wink, would be happy to assist in that regard as well. Because it's so interesting. No one knows we're here. Someone else said that.
Yes.
Najwa said she didn't even know the Task Force
Force are
Global
here.
Health existed.
Yes.
No one knows the NTDs exist. So spreading the word, asking for what we want and what we need, bringing people into the schools to talk to the kids. Kids love guinea worm.
Yeah.
There you go.
Like spaghetti.
I know we have a question over here in the audience. Young lady.
Hi, my name is Imelda. I am so excited to be here. Growing up in Africa, I can say that I'm very well versed in these neglected diseases. I'm a new graduate with an MPH program. We keep talking about how young people can help. It is very interesting. I will find great interest to see how I can contribute. Anyhow, I can contribute to, helping the people in the different countries and all of that. So where do we go from here as new graduates with an interest in NTDs?
Anyone? Where do you go? You have the knowledge, you're ready, you're eager. Where do you make that connection?
Every website.
Every website, I believe.
I would challenge you, and I would take that to a different level. You can become a Peace Corps volunteer. You can make a decision to go back to the country where you were born and try and work for the Ministry of Health to build capacity. Yes, Emily is an excellent, excellent proposition. And you can apply for jobs at the Task Force for Global Health. There are lots of opportunities in Atlanta. I listed a slew of them, and afterwards you can come and talk to me, and I will give you all of those names. But I would challenge, I was a Peace Corps volunteer. I spent 27 months dedicated to learning and being in a volunteer situation after I graduated from college. And that is the most rewarding experience I had in my life. So, besides my husband, which he's probably listening right now.
Can
I would challenge you and push it back.
Can I add
Yeah,
on
right.
to that, Kelly, a little bit? I would say also to be persistent. I started at the task force as a temp, and I was very persistent of coming to the task force. I came like maybe 3 years before I was even hired at the task force, and just wanting to know what was happening in this building. And just being persistent in trying to get into some of these organizations and just look for opportunities to serve and opportunities to volunteer, and for people to see that you're serious and you have a passion for doing it. And like I said, I started as a temp and ended up being hired as a full-time employee here at Task Force. And I kept coming and coming until I got a chance to know people.
That's awesome, Najwa. I didn't realize that.
Another question, back here in the back.
I think we're gonna do this
I'm
one.
s-
She's been waiting.
Okay, yes.
Me? Okay. Thank you. First of all, I just want to say how in awe I am of the three of you. I'm like really starstruck right now that the three of you are women and that the three of you are all so different. I'm like kind of tearing up. It's really beautiful. So I just got back from serving the Peace Corps for 2 years. I was in the Gambia in West Africa doing maternal and child health work. And if I learned two really important things, it's that you need to focus on capacity building with the existing structures, and you also need to have everyday citizens invested in what you're doing. Because when you leave, when I leave as a volunteer, or when your organization leaves, you want it to be sustainable. And so we're talking a lot about these big overarching companies like pharmaceutical companies or things like the Carter Center or the task force, but how do we ensure that everyday African citizens or South American citizens or Asian citizens are invested in these 53 cases of guinea worm that are left? Because those will persist until every single person is aware and wants to work to eradicate the disease. So how do we keep that chain moving and alive?
I think you used the key word, and Najwa just used it as well, persistence.
Yes.
Persistence, 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 focused, commitment, a groundswell. You know, it's not just top down, it's bottom up, it's all around, it's side to side. And it's also meeting people where they are.
Yes.
You know, meeting people where they are, and us coming in and saying, hey, we're here to help you get rid of guinea worm. And they say, but we don't have fresh water. And saying, okay, I get that. I'm going to meet you where you are, and we're going to try and figure out how to find some organization that can help. I can't, but let's work together. For me, that's the key. It's tenacity and persistence and building relationships, which is what we talked about earlier, and meeting people where they are. That's the hard course. The Sustainable Development Goals, for those of you that don't know, are a lofty set of goals to make these overarching gaps between the rich and the poor sustainable. And so it has to be just constant persistence amongst us. And I think, again, you and Najwa, persistence.
I would say that for our team, we do a lot of capacity building in countries. And our goals is to make the country supply chain stronger than how we found it. So we provide a lot of technical support, a lot of tools and resources, and we're there and we're training and just trying to understand some of the challenges that are happening there and just trying to find solutions on how to just sustain their healthcare system. So I would say that, you know, we're present on the ground and we're doing the work because it's important to us to leave the country better than how we found it, and they can utilize some of the information that we're providing to them for other programs, and that will help them be successful in the long run. So that's important to us.
Just to add on,
Please.
yeah, to add on from this previous one and what you have asked, in Tanzania we had a curriculum for primary school being revised and incorporating some of these NTDs, for example, Trachoma, and it's through the partnership from ITI and the task force. They helped us to put it in the curriculum. So children now learn some of these diseases back in the school. But it's not just say there is cascaded training which is happening. There are several tools. For example, at RTI we have a website, www.ntdtoolbox.org. There's a lot of material there, guidance from various partners where you can learn how things are happening, various tools. So please visit it.
NTDtoolbox.org.
Yes.
Technically, we're out of time, but I'm going to ask that we have one more question, and go ahead.
Thank you, guys. My name is Julian Fortuna, and I'm here from Decatur High School, which is like just down the road. Two of the questions that were asked before about sort of youth engagement, and I sort of just wanted to go back to that for a second and ask, what can young people do who are perhaps a little bit more aware of these issues but lack the technical expertise or the technical platform that you need to sort of get directly involved with medicine? What can young people do to get sort of concretely involved with advocating or doing whatever it is that people can do for these programs without sort of the medical experience, maybe, for example, in high school?
Good question.
I think you should run for office. Really, because I just think you're a little rock star over there. That's such a great question, and it goes back to what you asked as well. I mean, maybe we could work together, and you could give a presentation at your high school, and we could work that out to maybe broaden that a little bit. There's a lot you can do, but talking about it, and this is one thing that, the question that you asked about how do we make these things sustainable? We started a school trachoma health program in Ethiopia, and we believe that teaching one child the messages that child needs to know, and then you take that child takes that and teaches their family, and then they start sharing and talking about it. So, just start talking about it, talk more, share it with your friends, and, maybe be a little bit more aware and share it with your family. And again, let's talk and let's try and broaden that. Yeah. My epidemiologist would love to come to your high school and twist guinea worms with you. He would, and I know he would. But I think that you are a rock star, and keep that in your heart, because your passion is going to take you far in helping many others. Yes. And I'm so touched you're here today.
Yes.
As moderator, I maybe shouldn't do this, but I will interject and say, go there. If there's an interest that you have, go to that location. 6 years ago, I went to Liberia, and it was the most eye-opening experience of my life. I can't even tell you the way it changed me, even today. And so seeing how things happen, how things don't happen, the challenges, the opportunities, and the victories, it will change you. It will change you. So go if you can.
Yes.
All right. Please join me in thanking our wonderful and esteemed panelists. It's been a pleasure and an honor. Thank you.
It's been a pleasure.
And I would like to thank our panelists, Najra Pinto, Kelly, and of course, Jim Burris. By the way, if you are not already a sustaining member, I'll make the pitch for you, right? We need to do that. Public broadcasting does an enormous service for this country, I think. Today's panel has been wonderful, enriching. Thank you. And for those of you, the students and school teachers, think about this. Public health is very much an integrative discipline. It's not just science. It's social sciences. It's governing and government. It's policy. It's environmental science and health. It's everything that involves living, clean water, clean air. All of these are aspects of public health. And if almost anybody that's curious can find an interest and a career in public health. And it's a very enriching discipline in certain ways. Maybe not financially, but every other way, this is the place to be.
The work is rewarding.
So those of you who do have an interest in a future in careers, please, let us know about it. I also want to thank our teacher for talking about the opportunities for students. I would love to see us have more involvement with the schools, because the work we do, as you hear, is so exciting. I mean, when you actually are doing real humanitarian work and changing people's lives, you heard these stories of real people's lives being changed for the better. We do that every day by the hundreds of millions. And pretty much this is the only kind of discipline where somebody can do that and have that as the legacy of their time spent. But with this, I want to thank you. Please stay. There's more food. Circulate. Thank you for coming. We're really proud. And I will close by saying, as I came in today, Dr. Alan Hinman said to me, he says, I can't believe this is the first World NTD Day. And I said, well, it starts with the word neglected, doesn't it? So let's make it not neglected diseases here into the future. Thank you very much.
It was good. Thank you so much.
I really appreciate it.
Yeah.
About your scare.
Yeah.
I'm from Liberia. Yes. Yes. That was awesome. I'm from Liberia.
It was really good. Thank you so much. Congratulations. My name is Joseph.